Welcome to Vision TV. Today I am joined by Dr. Emily Stafford, who is with the Department of Psychology, but more importantly, you cover the psychology clinic. So you are the clinical director, is that correct?
Yes.
So tell us a little bit about what brought you to Mississippi State and about your current position.
Sure. So my family and I originally moved to Starkville when my spouse got a job on campus, and I moved to Starkville without a job, but had recently graduated.
She was hopeful.
Yes, I was hopeful and happy and excited to be here, and had recently graduated with a PhD in counselor education and supervision, and I also have a master's in clinical mental health, and so I'm a clinician by trade and am trained on training other mental health professionals and running a clinic. And so I was very thankful the psychology department gave me the opportunity to teach some classes, some undergraduate classes with them, and so I enjoyed doing that. And then an opportunity came open within the clinic. They needed a clinic director because the clinic had grown so much over the years that they needed somebody who could really get in there and run the clinic and help the students with that training opportunity. So our research faculty who had previously been running the clinic could really take the time to focus on their research, and they could bring in someone else to focus on running the clinic.
I mean, perfect match.
It
all the way
was. I was
around.
so happy, so thankful. So my family and I have been here at Mississippi State. We moved here in January of 2016.
Wonderful. Well, we are thrilled to have you here, and an important reason why we have you on the show today is some important changes to the psychology clinic, and we want to talk about that new location. Before we do, tell people what the psychology clinic does. I think it is a wonderful tool, resource here at Mississippi State that people don't know about.
Sure. So the psychology clinic falls within the Department of Psychology, and we are a training clinic. So all of our graduate PhD students who are in the clinical psychology PhD program, they're learning how to do research, they're learning how to work with clients and provide those clinical services. So they do research within the department, and then for their clinical component of training, they get to see clients within the clinic, and they're supervised by licensed mental health professionals.
Yeah,
so
great training.
So it's been wonderful, and we've seen more and more clients from both the community and from Mississippi State come through. We have students, staff, faculty, everyone is welcome to come through the clinic.
It's open to everyone.
Yes, and we provide both therapy and assessment services.
Okay.
And those services are sliding scale fee structure. So that means that if you have a lower income, you pay a lower price for that service.
Okay.
And in some cases, the services are free. So for example, we'll do free therapy for students. And if your income is below a certain level, we can also do free therapy for you as well.
And this is, so people know, separate from what the university provides as far as
Correct.
counseling
Yes.
services.
So students are also welcome to visit Student Counseling Services, which is located in Hathorne Hall. They're a separate office, and students can receive free therapy services there as well. But if perhaps students want to come get an assessment, maybe they're concerned that they have a learning disorder, or perhaps they're worried about ADHD, things like that, we can do those types of assessments. And there is a fee associated with assessment structure, but again, it's that sliding scale fee, so it's based on your income, and in many cases, it's very low.
Okay. And the exciting part for me, and I've seen a sneak peek of it, you have a new location.
We do. We were previously located in one of the little houses on campus, and we've moved to Rice Hall, located at 180 Magruder Street. We're on the first floor of Rice Hall, and we have an entire wing to ourselves now. So our space has more than doubled. Yes. So I anticipate that we'll be able to see more clients at peak hours. You know, typically the early afternoons and the mid-afternoons were a very popular time range for our students, and previously we were limited in how many therapy rooms we had. But now we have 2 kid rooms, we have 5 adult therapy rooms, and 3 adult assessment rooms. So very excited.
When I walked through, that was the first thing I thought is, my gosh, all this space now is wonderful. And anybody who's listening that thinks Rice Hall, You won't even recognize the first floor of Rice Hall.
Yes, they've done an excellent job with the renovation.
Looks great.
So my favorite part, I think, are the big murals that they've put up on the
Yes.
walls, the big kind of famous campus location pictures that they've put those up. It's really a beautiful space now.
And to welcome the community back and letting people know the new location, you have an open house.
We do. On August 30th at 11 a.m., we're going to cut the ribbon. So we've invited various folks from campus, and some of our clinical psychology PhD students will be there as well. And so we're going to cut the ribbon at 11 o'clock, and then starting at 11:30, folks can go through and tour the space. So, which is really a unique opportunity because
Yes.
typically the wing is locked for patient privacy. Of course, we want to respect everyone's privacy when they come to see us. And so it's not typical that folks get to go into the clinic unless they're receiving services from the clinic. So we're going to take the
That'll be
afternoon
great.
off from seeing patients, from seeing clients, and open it up to the community so they can come see what the space looks like.
What do you see being besides accommodating more people, what is the other advantage of having more space now that you didn't have before?
Yeah, well, previously our clinic location was separate from our main office location, so our faculty were located in another building.
Ooh, yeah.
And students as well, they would teach classes in other buildings on campus, or if they went to go meet with their advisor or go to their research lab, they would have to go across campus. And now the whole psychology department is in one building. So we take up Rice Hall 1 through 4.
It's a dream come true.
It really is. So if there's an emergency within the clinic, the supervisor can walk down the stairs instead of having to come from the other side of campus.
Wonderful. And so if somebody wants to seek services, know what services you have, where's the best location for them to obtain that information?
We do have a website, and at the grand opening, we'll have pamphlets and additional information as well. So if you go to the msstate.edu and in that search box, if you just put in psychology clinic, our information should pop up. And you can also access it from, if you go to the department's website, the psychology department's website, we have a tab on that main site that says psychology clinic.
So everything on the
you can-
website.
Yes, and so if you're interested in services, you can call us. That phone number is 662-325-0270, and you can call and speak with a clinician. So we screen all of our clients who are interested in services with us just to kind of get an idea about what their goals are with us. And if you want a phone experience with us, those are reserved for assessment services. So you want an assessment, we'll do your screen over the phone. If you want therapy, we invite you to come into the space and we'll do that screening in person.
Okay.
So the reports that are generated from those screening experiences, which are $0, they don't cost
Okay.
anything, those are free. The faculty who supervise within the clinic review that screening report to make sure that our graduate clinicians can provide that service and that we're a good fit for what you're seeking. And if they approve of the screening coming into the clinic, then you typically go on our wait list, because we do usually run a wait list for services, although right now our wait list for therapy is very low.
Wonderful.
So we only have a couple folks on it right now. So if you're interested, go ahead and get on the wait list. For assessment services, it's a little bit longer. Assessment services are typically 6 to 9 months is what we're running our wait list right now. But I always tell people, screening is free. It doesn't hurt to get on it. We'll call you when it's your turn.
Absolutely.
If you found services elsewhere, that's okay. We can take you off. But, it doesn't hurt to get on the wait list, and it's free.
Absolutely.
So.
And is telehealth available?
We do offer telehealth services. So we'll screen for that as well to make sure that your goal with us at the clinic is appropriate for a telehealth service. But we see clients all over the state through
Wonderful.
telehealth.
And we were talking a little bit before we started that there seems to be a little bit of a paradigm shift in how people view mental health. What have you
Absolutely.
seen during your career?
Absolutely. I've seen that people aren't as scared to talk about it if maybe they're experiencing a struggle or a challenge. We know that roughly 1 in 5 people in the United States experience some type of challenge or mental health crisis or, difficulty with mental health at some point within any given year. And so I think that there's been a change in conversation around that people aren't scared to seek help. There's not a stigma associated with it. as much as there used to be previously.
How wonderful.
So, and we have lots of resources on campus. People are reaching out to those resources, learning about those resources. So it's really an exciting time to be in mental health.
It is. And does that help get that sooner? That treatment needed? Like, are you catching things earlier?
I think so. I mean, I've noticed that, we were talking a little bit before we started, even within, the elementary schools now, they're talking about social emotional education, whereas, previously when I was a child, that wasn't included within our lessons. So I think people are being exposed to the concept of mental wellness earlier. And so when they come to college, and maybe if they're experiencing, maybe it's their first year here and they're away from their support system and they're looking to build that support system, they're able to reach out to resources a little bit sooner.
Well, the thing I love about this is it's such a win-win-win. It's a win for the Department of Psychology, for the students that get to get that experience they need, and for the community having that resource. So one last question, what have you seen as the person that supervises students in these services? How does that open their eyes to the profession?
I think our students are so bright, and they come from all over the nation. So it might be their first time experiencing mental health treatment within a rural environment. And I think we have a very special community here. So it's a small town. Folks know who you are, know where you are. And so it's important to be able to recognize the resources within that small town, just because in some cases those resources may be limited, but I think that generally Starkville is a very welcoming community. Everybody at Mississippi State wants to support you and help you, and so if you need a resource for something, we will help you find it. Even if that resource isn't us, we want to connect you with what you need so you can be successful.
And what would you tell that person that isn't sure if they need it or feeling like they might need something, but they're too afraid?
Yeah, well, they can always call and speak with a clinician. Our clinicians run our clinic. So I am the staff member that's there, but truly it's our students that are running this clinic. So when you call and you get somebody on the phone, that will be one of our graduate clinicians. And those clinicians are sometimes in with clients, and so there are times that the phone may roll to voicemail because they're in with the room with a client and they can't pick up the phone, of course, during that time.
Right.
But leave a message and a clinician will call you back, and you can just talk it through with a clinician if you want and see if you're a good fit for what we're offering in the psychology clinic, or if perhaps student counseling might be a better fit, or maybe even a community provider as well.
Wonderful. Well, thank you so much, Emily, Dr. Stafford, for what you provide our community, and we're really excited about seeing the new location at Rice Hall.
Yay, thank you so much.
Thank you. And thank you for watching Vision TV.